Let's talk a little bit about heart attacks. And I got 5 topics with you that I want to go through. One of them is what you're an expert in, which is doing cardiac and heart surgeries. In the world of business, you're in pressure a lot, a lot. You're having to make ends meet when you're starting the business. You have to hit numbers. You hire people, you fire people, you're hated sometimes. You got competitors, you got defamation of character, you got rumors, you got challenges, you got running out of money, you got economy, you got market, you got all this stuff that's going on. And you have to take care of your family, your wife, your husband, your kids, all this stuff you're dealing with. Obviously, there's a lot of pressure, right? A lot of pressure that builds up. And many times, I'm in a lot of different circles amongst other entrepreneurs that are running good sized businesses. What's starting to happen a lot that's coming up to me, and I kind of want to run this by you and see what your take will be on this, is a lot of people are experiencing panic attacks and anxiety attacks, and they're wondering if it's a heart attack. Okay. And so you have a very similar symptom here. Your chest feels heavy, your palms get sweaty, you feel a lot of pressure like an elephant is stepping on your chest. And then you realize it's a panic attack. You go to the hospital, it's like, no, you're not having a heart attack. You're totally fine. It's a panic attack. What is the different symptom between having a heart attack and a panic attack?
Interestingly enough, not much. And so many times, particularly in the emergency room, when someone like this comes in, luckily there are blood tests that are available to tell the difference right away within 30 minutes that it's a panic attack versus a heart attack, or there are no EKG changes, for instance, on a heart tracing. But there's, particularly, I think you're right, there is a high level of anxiety, particularly, obviously, for the last 6 months with COVID-19. And we're seeing a lot of people presenting with anxiety. Interestingly enough, as an aside, most people think that when they're under a lot of stress, their cortisol levels are high. And that's why things are going so wrong. Conversely, as I talk about in my upcoming book, The Energy Paradox, a lot of people think the same thing is adrenal fatigue, that they burned out their adrenals because of the stress. And I can assure you and your listeners and viewers that about 95% of people who think they have anxiety or high cortisol, or conversely adrenal fatigue, have absolutely normal cortisol levels, absolutely normal. And it's cortisol and adrenal fatigue is, unfortunately, it's one of those wonderful internet myths, and it sells books, but it's very, very rare.
So similar symptoms, similar feel, everything's the same. So when I hear people telling me, because I watch my dad go through a lot of heart attacks himself, so he would say you feel pain here, your jaw almost tightens up a little bit, right? And the pressure is a little bit center, a little bit left. I don't know if that's correct. Your left arm tightens up, a little bit of your left leg. Any other symptoms that you notice from all the patients you've dealt with all these years?
Well, interesting. Women have very, very different symptoms. You're describing typical male symptoms. Certainly, the elephant sitting on your chest is another good example. Women, unfortunately, often have none of these. And women more often will talk about having a queasy feeling in their stomach, or having a sense of nausea or belching or burping. And that frequently is, they'll just go, oh, that's indigestion, and what the heck, I'll ignore it. I'll take a couple of Tums and I'll ride this out. And interestingly, when you start actually talking with men, the number of men through the years that have angina or narrowings in their coronary arteries, oftentimes they will attribute this to heartburn. And I'll tell you a funny story. Back in the early days, before modern tests, we used to joke as heart and esophagus surgeons that half the time people we did bypasses on, what they actually had was heartburn. And half the time people who we would operate on their esophagus for reflux, they actually had coronary artery disease.
Wow.
We just didn't have the ability to tell the difference. And I think, so a lot of, particularly, the lay public, number one, men in particular are great deniers of, it's a toothache, or, I had too many spicy meatballs tonight and I'll just go to bed. Women, because I think of their role as the matriarch of the family, don't want to bother anybody. And quite frankly, physicians to this day, every study that's ever been done show that physicians do not give as much credibility to a woman's complaint as to a man's complaint. And much of women's heart disease is missed or ignored until often it's too late.
So, and why is that?
Don't get me started, but for the last,
I'm curious.
Well, for the last 20 years, in my new role in restorative medicine, teaching people how to reverse diseases rather than operating on them, I've come to realize that women, just as a general rule, get real short shrift from healthcare providers. Their complaints are, and I was taught this, their complaints are not to be believed. They're hysterical, they're emotional. This is all in their head. And one of the things that I guess has made me famous is that I've come to learn from my patients, many of whom are women with autoimmune diseases, that believe it or not, it is not in women's head. And if a woman has a complaint, it's to be taken seriously. Now, I'm a father of 2 daughters, and I'm married to a woman, and I have 3 female dogs. So maybe I'm biased from that. But I think one of the things we, as a profession, we really have not given women their due in listening to their complaints.